Oh, hey, fun seeing you guys here. Welcome to VIBE. I'm Dr. Oaks from South Portland, Maine. I'm an owner. I've been with the company since 2013. Welcome.
Hi, I'm Dr. Ari Choi, Associate Dentist. I'm super stoked to speak to you all this year at Aspen VIBE.
Hello, my name is Dr. Aaron Burnett, POP of Rio Grande, and I'm super excited to be joining you guys and speaking at this year's VIBE.
Hi, my name is Anam Ali, and I am a practice owner in the Dallas, Texas area, and it is such a pleasure to be speaking to everyone at Aspen VIBE this year.
Just a second, I'm moderating a very important discussion here. Hi everybody, I'm Joel Lowsky. I'm Aspen Dental Management's Director of Academic and Industry Relations. I'll be moderating the Ask Me Anything session today, and I couldn't be any more excited to moderate it. We want you to pose any questions you might have. The doctors are going to give you fantastic answers. Don't hold back. Find out what you want to know. It's going to be a great session. Thanks.
Hi, everybody, and welcome to the Ask Me Anything session. There's currently about 400 participating, which makes this the mother of all Ask Me Anything sessions. I'm Joel. I'm absolutely thrilled to be your host today. I think this is going to be an incredible session. I'm sort of mission control here. I've got a few different screens. If you see me looking around, I'm looking at the questions as they come in. I do my best to try to keep the questions sort of associated or thematically linked so that we're not jumping all over the place. But if I see a great question come in, I'm just going to take it. So just before we start, some housekeeping items. You can use that bit.ly link. That's case sensitive. So it's vibe-ama case sensitive. You can use that to submit questions. There's also a QR code underneath the image and on the screen right now. And you could certainly scan that with your phone and use that to submit your questions. There is already a lot of questions, and we've only got about 45 minutes, so we're going to dive right into it. And one thing I like, folks, about an Ask Me Anything, I really try to say there's no question that's off limits. So we're going to dive right in, and we're going to ask this question. Does Aspen get mad if you don't reach goals, and do they pressure you to reach goals? And what if you can't reach goals because you're slower since you're fresh out of dental school? Ari, you want to take that one?
Yes, I'll take it. So no, they do not get mad at you. Actually, as a matter of fact, they want you to take your time when you first start off as a new grad dentist to, kind of be more efficient with your timing. But they, like, my practice owner is actually Dr. Ali, who's on the panel with us today. And she told me, do not worry about time. I started back in August with practicing dentistry with my license, and the very first thing she said was to not worry about timing. So I kind of just didn't look at the time, and of course it took me 2 hours to do my first crown prep, but today I'm at 12 minutes for one crown prep. So she always told me everything comes with time, and it really does. So do not feel pressured to meet quotas, because there is no quota to meet.
Thank you. It appears there's a bunch of questions on mentorship, so I think this is probably a good place for us to start. So what are the opportunities for mentorship? Dr. Ali, you want to take that one?
Yeah, so from my perspective, right now I'm mentoring Ari and 2 other doctors. And the way mentorship works is to understand what your doctor's goals are and what drives them, and match them up with what you can provide for them, and foster that growth and have regular check-ins to make sure we're getting to that and we're continuously developing, addressing challenges for that growth. So for me, I provide mentorship on leadership, communication, support with learning and development, and making sure my doctors have all the resources that they need. And that's what's so great about partnering with a company like Aspen, because although I'm very confident as a provider, I know that there's a lot more resources out there that Aspen can provide for us. And I want to make sure that all my doctors have access to that all the time.
Thanks, Dr. Ali. Dr. Oaks, what about you? What are your thoughts on providing mentorship?
That was the first thing that I looked forward to when I graduated from dental school. I needed someone to be there to help me if I got stuck with an extraction. I wasn't sure how I was gonna, complete a crown prep for like an anterior veneer. I'd never done one in dental school, so it was good having someone who had been a dentist for a period of time to help me kind of foster that relationship to get through that process and like have clear set goals of completing all my tasks and duties in one day.
Thank you. Dr. Burnett, want to add anything on that?
Yeah, I think it's so important coming from my background. I didn't have a mentor straight out. I was just kind of on my own. And then coming to Aspen and then feeling that, it helped a lot, yeah.
Great. Thank you. What did you struggle with as a new doctor, and how did your mentor help? Ari, you want to take that one and also put Dr. Ali on the spot?
So I graduated with the infamous COVID class. So I didn't get to practice dentistry for 5 months. I was about to say 5 years, but 5 months. And it was kind of the opposite of a confidence booster. My confidence was kind of low, especially because 5 months is a lot in the grand scheme of things, because I was in clinic for 2 years. So starting right after COVID, I was confident, but it quickly tapered down. And once I started back doing dentistry, my confidence was really low. I really wanted to pick up on my speed again. When it came to surgical extractions, I thought I knew how to do it, but I really didn't. Our school, we have Tufts has a very extensive residency program. So all the complicated procedures we would always refer. So I didn't get a chance to do high surgical extractions. So in terms of that, I got more exposure to it. Dr. Ali gave me really good feedback and tips and advice on how to use a surgical handpiece, as well as using the instruments, the correct instruments. And then I'm in the doctor's developmental program, and everyone who starts off in Aspen will go through that with their practice owner, and they'll kind of set that up for you. So I was with her for 5 weeks, and then I went to a high volume office where I got to work with Dr. Nelson Nunez, and that's in Texarkana, Texas. And I had the opportunity to stay there for 3 weeks, but I asked to stay a little longer because he was actually looking for an associate, and he was able to hone my skills furthermore. And he actually does a variety of procedures. He pretty much does everything. He only has an oral surgeon and an endodontist come just because he has excess stuff that he can't do because he doesn't have enough time. So I was able to see more complicated procedures there, and now I know how to do a bone graft. I know how to do really good treatment planning when it comes to partial dentures, which was something I was not very comfortable with. So I've grown a lot over the past, how many months has it been? It's been 4 months, or actually no, 3. It seems like forever, but I'm really excited because this is kind of going past the question, but I'm going to be NCD in January in one of Dr. Ali's offices that's opening up in Southern Fort Worth. So I'm really excited, and I feel like what I've learned over the past few months has really gained momentum.
Dr. Ali, can you comment on what you may have struggled with when you were fresh out of dental school?
Yes, so sorry, you might hear a background noise, but I struggled with speed. I feel like I didn't get to build speed coming out of dental school because we only saw 2 patients a day. It was 1 in the morning, 1 in the afternoon. So I knew that was my weakness, but I expressed that early on, and I had said that this is what I want to focus on. And I was really nervous, but I know that when I signed with Aspen that I was going to be able to get the support and the mentorship that I needed. And so the doctor that I worked with, he understood that I needed to build my speed. So he allowed me to pick and choose whatever I wanted on the schedule, so that I can hone in on my skills and just become stronger as a dentist. And I feel like that helped me a lot. So that's something that I try to provide for my doctors, to really see what it is that they need and just allow them the opportunity to get that experience.
Great. Dr. Oakes, how do you support your younger dentists as they're struggling to get their feet under them?
I just give them the time that they need at first. I allow them to kind of move through the office with me. The first 4 weeks, I have a shadow basically, and by the end of 4 weeks, I'm not doing any procedures and you're doing every single one of my procedures. I'm there to step in if we get behind and start the next procedure, or to step in and help with an overflow step if the doctor's stuck with something. And it seems to be working out. I'm working on, we're doing our third. We have 3 doctors right now that we're training, and it seems to be working very well for them.
Great, thank you. So there's a good follow-up question here, sort of a 3-parter. In your practices, how many patients do you see per day, and how many does a new associate see per day? And then how long do you think it took before you were comfortable seeing that many? So let's start with Dr. Burnett. How many patients per day, and how many patients does the associate see, a new associate?
I think we have 6 new patients a day on average in my office. Plus, let's just assume that the procedure chair is full. So, 15 patients a day plus overflow. But you get a lot of help from your team with that if you've trained them right. My associate is actually my wife. So I just give her the time she needs, just like all the other doctors echoed, and she's picking up procedures, and I'm just there as a parachute if need be.
Thank you. So Dr. Choi, what about you? How many patients did you see when you started, and did it take long for you to get comfortable with that number?
When I first started in Grand Prairie, I saw probably, I want to say, it was so long ago, maybe like 4 patients, because we were a new office. We opened back in August, so it takes some time to build up that patient base. But in Texarkana, I was actually left alone at the office twice a week, and I saw about 30 to 35 patients, and I'm actually very comfortable with it. At first, when I was left like to go do it, I was like, oh my God, I'm kind of scared. But you have to kind of be thrown into it in order to learn, especially for me. So by the time I finished up my 7 weeks, which was about a week ago, we finished on time. It was a 8 to 1 schedule, and yeah, I saw about 35, 36 patients that day.
So a question just came in, and it's perfectly logical to me. How do you make sure when you're seeing that many patients that every patient is getting the right standard of care? Dr. Choi, why don't you answer that one? Let's start with you again.
So first of all, you want to have a really good team. If you have everyone who's on board, like your dental assistants, your front desk, everything will work seamlessly. Your dental assistants will help with any kind of adjustments in terms of immediate dentures, but then with permanent ones, your lab tech will help you. So you kind of have to get the flow right. You have to be able to go numb, go see that new patient, come back, do the procedure. It's all about having a game plan when you start the day and then trying to follow that. But obviously not everything always goes according to plan. So you have to be able to, come up with a plan B when things don't go right, but you just keep chugging along. I mean, if if things don't go according to plan, you can't be like really upset. You got to just keep moving. And if you do that, you'll be able to finish close to time or a little past time, which is okay.
Dr. Ali, I see her smiling and nodding. So what about you? Do you have any comments or perspective on how you get up to speed with a large number of patients, making sure everybody gets the right care?
Yeah, I would echo everything that Ari just said. I do things the same exact way. I feel like it takes time to get there, but the way we've developed the teams is my dental assistants are an extension of me. We sit down, we talk about different procedures. They have a lot of knowledge. So I've invested a lot of time in them so that they can answer questions for patients. And if they ever need, they can pull me in. And that allows me to focus in with the new patients and give them as much time as they need. So really you have to invest a lot of time in the beginning to develop your team, and then everything sort of just falls into place.
Great, thank you. Aaron, this one's specifically for you. So somebody's paying attention and they see that you just opened in New Jersey. So I'll rephrase it, but how do you get so many new patients when your practice is brand new?
It's just you got to trust ADMI and Aspen. They're gonna pick the spots where there's a need for patients, and they take care of all marketing, advertising, anywhere they bring the patients in. So it's never been a problem in any office I've ever worked in with Aspen. The new patients come.
Great. Thank you. All right. So we're going to turn into a bit of a different direction. There's a lot of questions on this. The category for the moment is COVID. So let's start with arguably the most obvious question. Have you been able to get all the PPE that you need? Dr. Oakes?
Absolutely. Some states require different levels of PPE, and Aspen's been on top of that for us, but I have more than enough for KN95s, N95s, ASTM3 masks. People who are, if you're missing these things across the country, it's because everyone's buying it in surplus now. Even restaurants are buying like Cavicide and masks. So the supply chain is lacking, but Aspen's been ahead of that the entire time.
Great, thanks, Dr. Oakes. I'll add a little bit to that one. Interesting fact of the day, Aspen Dental is the second largest client of Henry Schein after the United States government. And so we leverage our scale to be able to make purchases and stock up our practices. Starting around June, we were able to assure 30 days of PPE in every practice across the network. So that's one of the benefits of our scale. We're able to make orders for everything from PPE to intraoral scanners, and we pay a very, very competitive price for those, and we're able to get the inventory that we need. How is Aspen managing to stay open during the COVID-19 process? What steps are you taking to ensure everybody's safety? Dr. Burnett?
We follow standard protocols set out by CDC, and ADMI has their recommendations, but at the end of the day, it's whoever is leading the office. So we do our medical history. They do a COVID consent, which asks questions about recent travel, any exposures, anything like that. We do take temperature on every new patient, and just use your best judgment and treat every patient as if they had it, because it's about keeping our team safe, but more importantly, keeping the population we're serving safe.
Great, thank you. Dr. Ali, anything you want to add regarding PPE or how COVID has impacted your practice?
I would say that patients still need the care. So you have to keep the doors open in order to provide them with care, but also you have to practice proper protocol on the team's end to make sure that you're ensuring the safety of the team and your patients. And we're able to do that just by making sure we're talking about it every day. Everyone's getting tested if something comes up.
Great, thank you. So there's some questions that are coming in about sort of what the general day-to-day is like. So there's a question here that is, who would be my boss? So I'm going to take a moment to tell a quick story. There's Aspen Dental Management, which is actually the company that I work for. And then there's the Aspen Dental Practices. And the Aspen Dental Practices are owned by the clinicians, Dr. Burnett, Dr. Oakes, Dr. Ali, Dr. Choi someday. And so your boss as an associate is your practice owner. So I think that's a good one there. How are patients, this is sort of in a similar practice management style, how are patients assigned to a practitioner? Dr. Oakes, is there a particular method for that in your practices?
I mean, it's whoever has availability in my office, because we're so busy. If I go into the new patient and the patient wants to see me only, that's fine, but I'm booking out into January right now, and my associate's booking out into, the next couple weeks. So if patients are okay with seeing anyone with first availability, that's usually how it works. But if they want to specifically see me, they're allowed to do that too.
What about who chooses the lab, suppliers, and materials? Dr. Burnett?
Yeah, that's practitioner or provider to provider. Whatever you're getting the best results with, I think you choose whatever lab you want to use, at the end of the day.
I'll jump in for a sec. The vast majority of Aspen Dental practices have a lab on site, which is part of the business model. It allows us to return dentures and other prosthetics in an incredibly short turnaround time. Here's a fun one. So what is a memorable moment which impacted your life, which impacted the life of a patient from your perspective as an Aspen dentist? So this is a story question. Dr. Oakes.
We get to do free care, or we've done free care for veterans for as long as I can remember since joining Aspen. And last year, I provided a full mouth rehab for a patient, 2 bridges, single unit crown, and a roundhouse lower bridge from 18 to 31. Changed his life. He'd been missing teeth for, 30 plus years. I've never seen a happier guy in my entire life.
Thank you. I think this is a question that everybody should get a chance to answer. Dr. Burnett, any patient stories that you felt you had a major impact?
Well, anytime you do those nice cases like Dr. Oaks was talking about, it's really rewarding, and we do get an opportunity to do a lot of whether it just be extraction and insertion of a traditional full upper, full lower denture. It's always nice to see the patient's reactions when you see them follow up. They're always super excited.
Thank you, Dr. Ali.
Yeah, for me, it was a 20-year-old girl. She had a lot of medical conditions. She wouldn't go outside. Teeth are completely destroyed because of all the medications she was taking, and she had zero confidence. She wouldn't even speak during the new patient exam, and her mom was speaking for her. So we got her mouth rehabilitated, and she was in so much shock that she didn't know her mouth could look like that. And so she came out of her shell. She got married. She actually came on as one of my employees after. So it was just really great to see someone turn their life around because of their mouth. And it really is a team effort. So that's always going to be one of the most memorable moments that I've had.
Thanks. Dr. Troy, do you want to share a quick story?
Yeah. So this was my last, there's a lot of stories, but this one is the one that resonates with me the most recently, because there's a patient who came into the Texarkana office, and she just got 2 crowns, but she said she was at another office where they were shaming her. And like everyone from the staff to the dentist, they apparently told her that, you know, like your mouth is all messed up. And like, she started crying to me, and she's like, this is the best dental care I've ever received. And I was literally just delivering the crowns, and she was crying and sobbing, and she was just so happy, and it really touched my heart.
That's great. Thank you. So a couple of good follow-up questions coming in. I try not to jump around topics, but I want to make sure we ask these. Back to COVID for a second. Are there any procedures that you're not performing? Anybody?
No.
No. Okay.
I mean, if the patient comes in and they're COVID positive, then we're not doing anything on them. But what I'm finding right now is anyone who's really sick, they're doing the right thing. They're calling us and saying, I'm not coming in. I have the sniffles. I have a cough. I am at risk. I don't want to expose you guys. So our risk is very, very minimal.
Great, thank you. There was a follow-up question earlier, and I think it's related to the question about how many patients we have in a day. And the question, I'm going to read it exactly as it is. So 15 minutes per patient, no matter what the procedure.
No.
Anybody?
I think it's all about multi-room movement. You know, you're not sacrificing your time with the patient in the room. You get what you need to get done. Your team is working on the other patient, and you just flow through. So you're never rushing with individual patients. You're making sure your team is moving fast when you're not there.
I mean, there's downtime in between procedures too. Like, I'm not going to sit there and wait for anesthetic to kick in on a full mouth extraction. I'm going to step out and take a quick 2-minute impression. If an impression takes you 45 minutes, you need to work with your owner to figure out what you're doing wrong. A wax bite, same exact thing. It takes me 30 seconds to talk to the patient to figure out where their bite should rest, where they should be at rest, and then get the wax rims fit and back out the room to go start my extraction case.
Great, thank you. So here's a question that falls squarely into the anything category of Ask Me Anything. Everything sounds so positive. What went wrong or was disappointing along the way?
Myself. I disappointed myself. I made mistakes. I overlooking like treatment plan options for patients, overlooking like medical history. And it's just because, not that you think you're invincible, but because when you step into a room, you've seen dentistry so many times, you're like, this is the same exact procedure I literally did 5 minutes ago. But the one thing that you have to focus on is that the patient in your chair is completely different and separate from the person that you just saw. And so when I first started, I would just get into this routine of doing, not reviewing what I was going to get started with this patient. And now I make sure that my staff understands that when I walk in the room, I want the x-rays up. I want the patient's health history ready to go so I can review everything. If they haven't asked any health history questions, I'm going to tell the staff, you need to do the health history. I'll be right back in a minute.
Thanks. I want to make sure everybody gets a chance to ask this one. Anybody else want to say? The question was, everything sounds so positive. What went wrong or was disappointing along the way? Dr. Ali, anything?
Yes. So again, I would say it was me as well. In the beginning, as I was a first year practitioner, I lost sight of my goals and what I wanted to do. And my body was starting to break down because I wasn't working out. I was losing balance, and it was affecting my mindset when I would go into work, but it's because I wasn't giving myself time. So after the first year of working, I totally changed my life around. I started working out. I wake up at 4 a.m. every morning to work out. I do my reading, and then I go into work. So I'm already prepared for work. I'm already awake. My mind is already set. So you have to figure out what it is that you want, and you have to go in and implement it. And you have to be able to pivot and maneuver when things aren't right. You have to be able to make those changes for yourself. And when you need support, you have to be willing to ask for it.
Thank you. I want to give the floor to anybody if they want it. Dr. Burnett, Dr. Choi, anything you want to add on this one? Anything
Dr.
disappointing along the
hit
way?
it on the spot. She hit it on the spot.
All right, great. Thank you. There was a question here. The question is, if for some reason our office is not the right fit, are we able to leave, or are we contracted to stay for X number of years? So I'm going to handle this one for a second. Aspen Dental practices pride themselves. We don't have a contract. We have something that's called a letter of agreement. And one of the reasons why that's important to say, you are not really contractually obligated to anything. Most importantly, things like a restrictive covenant or quotas, those literally just don't exist. And I don't know if any of you read the blog posts that I did for ASDA a little while ago. A restrictive covenant, in my opinion, is a terrible thing, and that's usually something in a contract. Imagine living somewhere and then things don't work out and you can't practice where you live. That's what a restrictive covenant is. And so the prompt was about, are we contracted to stay for a number of years? There is nothing binding in an Aspen Dental letter of agreement, and we don't use the word contract. So I'm glad I was able to ask that one. There's been a bunch of questions about this, and I'm just being frank with the audience. I don't know if our folks will be able to answer it, but we'll ask it anyways. Why did you choose Aspen Dental over a different DSO? So was anybody in that position? Dr. Oakes?
No, I wasn't. I can tell you the reason why I did join. I've thought about this, and working for Aspen for 7 years, I could give you a million different answers. But the number one reason why I came on and joined Aspen Dental was because of the owners. I knew people that worked for the company. I love them. I love their mentality. I love their personality. I love their outlook on life. And I ran with it. I didn't look back.
Thanks, Dr. Oakes. Did anybody else consider other DSOs?
I did. I'm not going to mention which DSOs, but I just really like the model of Aspen Dental compared to other DSOs, because a lot of it's production-based and some are pushing for certain procedures. With Aspen, I've been able to be an ethical doctor and going with what I want to do as a practitioner, and I'm not comfortable with going with someone else's treatment plan. I want to be able to treatment plan by myself. And if I make a mistake, I'll own up to it. But that's how you learn as a clinician. And I've been hooked since a first year dental student. That was the first time I was exposed to Aspen. Went to Aspen by the end of my second year in Atlanta, and Hotlanta. And fourth year, it was Boston Vibes. But at that point, it was fourth year in Boston Vibes. Third year, I already signed. I knew exactly where I was going, and Aspen made it happen for me. So I was like, you know what? If they're able to accommodate me, I'll accommodate them. So that's why I give it my all whenever, I work every day.
Thanks, Dr. Choi. So that actually leads in perfectly with a question that just came in. Who does the treatment planning? Do I treatment plan for my patients? Dr. Burnett?
Yeah, I treatment plan for my patients, and when Dr. Kate, my wife, goes into a room and she treatment plans, she does her own treatment plans. But I mean, 2 eyes on one problem is always a good idea. So if she reads my treatment plan that I just did and she sees something else on X-ray, we discuss it. There's always a discussion. We're partners in this thing. We're colleagues. So having 2 eyes on every problem is a good idea.
Great, thank you. Dr. Ali, same answer from you?
Yes, same. My doctors treatment plan for their own patients whenever they see a new patient. And if anything, we'll talk about it afterwards if they have questions. But it's their license. They're the ones practicing, so it's their treatment plan.
Great, thank you. So there's a few questions that have come in on this topic. How would you say the work-life balance is at Aspen Dental? Dr. Ali?
It is what you make of it. You have to create that balance for yourself. If you want to go travel, you have to take the time out to do it. You're working 5 days a week, and Fridays were half days. So if you want to do it, you go ahead and do it. You want to work out, you have to set your own priorities and create that balance for yourself. But for me, I have a very holistic approach in my mentorship. And I tell Ari all the time, are you working out? Are you reading? Are you spending time with your fiance? And I'm sure she can vouch to that. But it's very important to me, because then you're going to be happy coming to work every single day and be able to give all of your time and attention to your teams and your patients.
So, Dr. Burnett, you just opened a new practice. I imagine there's a lot of work in that. What about your work-life balance?
Yeah, I agree with Dr. Ali. I mean, I'm with her on that early morning wake up to go get the things I need to get done, the workout, because we drive 40 minutes to work, do that long day, and then we drive back. So, it's up to you to make sure that you're balancing that, because, I mean, dentistry is hard. At the end of the day, it's hard for everybody. So once you get to the office, you put in 8 hard hours, but you go home at the end and you kind of can leave it there if you wish.
Great, thank you. So here's one. I like this question, not an easy one. What is your response to some of the things that people say about Aspen, that you're a denture mill, that you have quotas, that you rush patients through? Dr. Oakes.
I just tell them they know nothing about us then, because if you're passing judgment on us and not even work for us, then you're not someone who'll ever work out for our company.
Great, thank you. Dr. Choi?
Yes, going off with what Dr. Oates said, yes, I have friends that say all these things, but I go, well, why don't you come and shadow me? And they're like, well, I'm busy working. So I was like, well, you have no room to talk then. I think it's just a bunch of brainwashing that we get while we're in school, especially because our faculty members, they own a lot of private offices, and right across the street, a DSO would open, and it really crushes them. But the thing is, at the end of the day, if you're good to your patients will come to you. If you lose that patient, then maybe you weren't vibing well with them. So I just shut them down, and I was like, look, this is my career, so stop talking crap.
Thank you.
I'd like to speak to that, Joel.
Thank you. Go ahead.
I was on the other side of this as a student, because that was my perspective, that all we do is make dentures. And I was given the same answer, come and check us out. And it totally changed my perspective. And I'm a walking, talking example of how balanced the treatments can be. And it's what you make of it.
And I would say too, like, our patient base is a little bit different from private practices. My friends see a completely different education level of patients with insurance who don't have insurance. I would say we get a lot of patients that come to our office that have nowhere else to go because they have a benefit that they can't use anywhere else, at least in my state in Maine.
Great, thank you. So this category is from if you guys are Jeopardy fans, this is from the potpourri category. Have any of you done a GPR or AEGD? And if not, do you feel that your transition to working as a dentist would have been easier if you had done one? Anybody?
I didn't do one.
I didn't do one. However, I have a lot of friends that are in a GPR and AEGD right now, and they're only seeing like 2 to 3 patients a day, and I'm like, oh, that's sad.
Right. Great, thank you. Would you say, as a new grad, if you have the opportunity to work at an existing Aspen Dental practice or a brand new one, would you say the experience would be any different in either of those?
I think so. I think it's always good to work with a POP or owner, somebody that can be in the office with you, give you that mentorship or guidance whenever you need it, just some support. That's just my perspective, though.
Great, thank you. Good question here, and I think it was inspired by a comment before. In general, what does the patient pool look like, and what would you say are your most common procedures? And when you answer this, let's remind the audience of where you're from. So, Dr. Ali, what does your patient pool look like? What are your most common procedures?
So right now I'm in Grand Prairie, Texas. It's pretty suburban, so my patient pool is middle class, people that work 9-to-5 jobs. So because of that, we've had to modify our hours to provide them with access to care. And we do implants, extractions, dentures, lots of crowns and bridges. we have a very good balance in Grand Prairie. And then before, when I was in Alcoa, Tennessee, closer towards Knoxville, we did a lot of extractions, a lot of surgery. So I got really good at surgeries from there.
Great. And Dr. Burnett, in New Jersey, what's the patient pool like, and what are your most frequent procedures?
Same as Dr. Ali said, middle class. A lot of people, this is their first dental experience, it seems. They come in, they got nowhere else to go. It's bread and butter, but it's whatever you can treatment plan that can be accepted by the patient. So whatever you want to do to help that patient, however complex, but a lot of fixed, a lot of removable, but it's all good work.
Great, thank you. Dr. Ali or Dr. Oakes, so do you want to comment on that one?
I mean, the only thing that I would add on top of it is, it does depend on the demographic. Like if you go to Florida, for instance, I've seen a lot more of the owners down there placing more implants than the Northeast, but then you go into like the Massachusetts market and they do a ton more implants and restoration versus what I'll do in the state of Maine. But I'll also say like the population in Maine is aging. We're getting a lot older and there's less young people in our state. So that's the caveat that I've noticed.
Thanks, Dr. Oakes. Folks, just a reminder, we've got about 9 minutes left. The questions are pouring in. I'm doing my best to keep up, but I don't think we'll be able to answer all of them. If you are not scheduled to interview this afternoon, please go ahead and request an interview. That way we can answer some of your questions. You could do that right from the main virtual venue page. I'll do my best to squeeze in a few more questions here. What kind of technology is in use at your office? Dr. Oakes.
We just installed a CBCT in 2 of my offices, and all 3 of the offices have iTero. The 3rd location, we're not going to install the CBCT until we relocate that office to a bigger footprint. But now we're going to have we'll be able to scan patients, CBC, upload that in, take their iTero scan, upload that, and then do digital stents off that so we can place implants and do everything digital surgery, basically.
So Dr. Burnett, you just opened new practices. What technologies are implemented at a brand new practice?
Yeah, CBCT, we have the iTero, like Dr. Oak said. It's really fun messing with it. Patient comes in pain, whereas before we don't send you to endo. We'll just grab a CBCT and we'll go hunting for a fracture. It's fun to mess with all these toys.
Great. So Dr. Choi, as our most recent dental graduate, did you have access to an intraoral scanner or CBCT machine at Tufts?
Oh, not as well. Actually, CBCT, yes, but our radio techs would just do that. And then in terms of iTero, no, I didn't even know an iTero existed. I always say if I can marry an object, it would be an iTero. My fiance's in the other room right now, so he probably hears me like, oh my God. But it is amazing.
Folks, at one of our earlier vibes, we actually set up a bunch of iTero scanners, and we had a contest. Whoever could scan a full mouth would win. And a dental student scanned me, and she was very new to it, and it took her about 10 minutes. And she didn't know my name, and I didn't know her name, and I always refer to it as my one-night scan. And sometimes I wonder what's happened to her. True story. Speaking of important questions, yes, this is the infamous tooth tie. I'm glad we got to cover that. Geez, there's so many pouring in. I want to make sure I get the right one. Is there anything that you would have done differently given where your career is now? Dr. Burnett?
I think early on, taking advantage of all the things that Aspen, the continuing education that Aspen offers, it's easy to get caught up in the zone of just like, I need to work. I need to go to work every day. I can't take any time off. But, I think it pays off in the end to just maybe take 1 week or 1 day a month to just do some continuing education.
Great. Anybody else? Anything you'd like to do differently or change?
Yeah, have kids earlier.
That's good advice. That is not the official Aspen Dental perspective. Thanks, Nate. So for our practice owners, there are folks asking the question, and this isn't Ask Me Anything. How much did it cost for you to open a practice? If you don't mind sharing.
$350.
$350. Thank you.
That's a new office. I bought 3 owned offices, and my investment was over $1 million.
For 3 practices.
Mm-hmm.
Great, thank you. Here's a good question. Have you all done implants on patients so far? Anybody not? No, Dr. Oakes, no?
I'm behind.
You're behind? Dr. Ali? You're on mute, Dr. Ali.
Sorry. I have not placed implants yet, but next weekend I'm taking all 3 of my doctors to a course to learn how to place implants, because that's what they all want to do. And we're going to learn and grow in that together.
Great. Who's providing that course?
It's by an external company. It's by Implant Direct. Yeah.
Great, thank you. So folks, one of the things that we've talked about briefly is CE and mentoring. We are currently in the process of building an internal training program for implants. We have a fantastic new senior vice president of implantology, Dr. Rawal. Don't get mad, I'm not sure that's the exact title. But that's also one of the reasons why we're pushing out the CBCT scanners to every location. Okay, so here's a question. This was questioned, admittedly, this one's not live. This was submitted beforehand, and it was the shortest question submitted, and the question is just their journey. So, Dr. Ali, what was your journey to get you here today?
So my journey is, I went to dental school in Miami. I wanted to leave the city life and go focus on myself. So I moved to Knoxville, Tennessee, so that I can practice dentistry. I can focus on myself. I can read. And then I was offered, after a year, I became the MCD. And once I had stability in that, and I showed that I can drive an office, I can lead my teams, I was offered the opportunity at Partnership. And I was going to say yes, and I was going to take it. It's just that I wanted to go live somewhere else. So I raised my hand and I said that I'll go wherever. That's literally what I said. And I was supposed to move to Philadelphia to open up the Philadelphia market. However, in the middle of COVID, I got a call with an opportunity to move to Dallas, Texas. And within a week, I said, yes, let's go. Packed my bags. 2 days later, I was in Dallas, and here I am, opened my first office in August. Second one coming this November, and third one in January.
Wow, that's a great story. Dr. Burnett, do you want to share your journey?
So I went to NYU. I met my wife there. She was a year behind me, so I didn't want to do a GPR. I was like, enough of this. I need to go make some money. So I worked at a Medicaid office in Springfield, Massachusetts. Just really cranking, just doing a lot of work. But after a year, I was like, I need something more. I need to do more fixed. I need more experience, doing better cases. So I reached out to Aspen. My buddy worked for them, and I drove to Cape Cod and interviewed with Dr. Taylor. We really kicked it off, and she offered me a MCD position in Hanover right there. And I've been there for 2 years. And like Dr. Ali said, I just had my hand up. I would bother Joe Nelly like constantly. It's like, give me an office, give me an office. Do you see what I'm doing out here? And finally, yeah, it happened.
Great. Dr. Oakes, you want to tell your journey?
Yeah, I went to Tufts, graduated in 2013. I had done a bunch of interviews in private practice. I figured I was going to hang my shingle. It just never worked out. All the doctors wanted to have 2 years experience or GPR. After I heard from my friend, Dr. De La Rosa, that he had such a great experience going from private practice to work for Aspen Dental and then bought 2 offices, I joined the Griffeys up here in Maine, and I eventually bought their offices in 2017.
Great, thank you. Dr. Choi, we're going to skip you. You told us your story before. Folks, by my count, we've got just over a minute left. It's kind of a corny question, but I always like to ask it nonetheless. If you could summarize your experience at Aspen Dental in just a few words, let's say 5 words max, what would they be? Dr. Burnett, you're at the top of my screen. You're in the hot seat.
I think just keep moving forward. It doesn't have to end with one office. It doesn't have to end with MCD or an associate. There's always somewhere to go from there. So if you want more, you could always grow. Great, thank you. Dr. Oakes?
Happy-go-lucky. you can't. That's the only thing I could say. It's a happy place.
Thank you, Dr. Choi.
I say the people are amazing.
Thank you. That's wonderful. I'm assuming you're referring to me, so thank you. Dr. Ali, you're muted. Take yourself off mute, please.
Oh, there it is. I would say 2 words, beast mode. It is what you make of it.
Awesome. Thank you. Well, this has been truly a fantastic Ask Me Anything session. I sincerely hope you enjoyed it. I did my best to get to the questions. There was an awful lot of questions. Please don't hesitate to reach out. There's that option in the lobby to schedule an interview. You can certainly ask all of your questions then. Just a reminder for those of you that are interviewing today, you receive your interview schedule over email, but you can also find it in your profile, in the My Profile section. Interviews begin for those of you that have the first session at 1:45 p.m. So please, everybody, enjoy your 15-minute break. Thank you very much for your time today. I sincerely hope you enjoy this and have a wonderful rest of Vibe.